In this video, I'm going to be showing you how to use the Mental Healthcare Portal. And it's especially interesting because it has a guided interview. Let me just jump in and get started here. So the way to get going is to go to the SACRD homepage. We have the list of portals shown there. You can pick the Mental Healthcare Portal, and it takes you to an intro page where you can get access to a guided interview, or you can just go directly to the filters and not use the guided interview if you're familiar with how this system works. But let's say that we're not familiar with it, so we're going to go ahead and go through the guided interview. And I'm going to use a scenario, a couple of them here, to work through things. So Carol's teenage son has lost interest in doing anything and gets no pleasure from engaging in any activity. She believes the best help for him at this point is to talk with a professional. Carol lives in 78213 and has Medicaid for payment. Okay, so we're going to do 78213 and get that set up into the system. And we're doing this for a family member. And it's for her teenage son, so let's get that entered into the system. And it is a guy. And we've chosen to word this in the form of experiences, so it's not using the clinical terms here. And so there's a lot of opportunities here for, try to understand the words, what they say. You don't have to know the technical definitions of things. But in the case of her teenage son, it's most likely this first one. So we'll select that. And this is getting you a chance to say what kind of person you want your son to talk to. And let's assume it just really doesn't matter, so he'll talk to whoever. He's perfectly fine in English, but we are going to have Medicaid. So this is the last of the guided interview, and now we're back into the filters page. And I have pre-selected the things that were important to us. The fact that he's experiencing mood disorders, that's the clinical term for it. He wants it in English. It is a youth. It only pays with Medicaid. And the type of the provider is not really all that important. And this has narrowed the programs down to, 235. That's still a lot, I suspect. But 30 of them are virtual. And we were looking for a counselor directly. I'm going to select the counselor one now. And now we're down to a little less here. And what this is, these are all appropriate programs. Now, as I roll over them, you can see what part of town they're in. If you want to zoom the map, you can. And if you want to move the map to where it's more appropriate for where you live, then you can certainly do that as well. And this will resort them. So in this case, Roy Moss Youth Alternatives might be a good option for the child or the teenager in this case. And if you want to find those that are open now, you can certainly do that. And that limits the choices to those that happen to be open now. Or maybe you want one that's just working on the weekend. And again, you can say, you can filter it and only show those particular ones. So let me clear this and do another scenario here, perhaps. Juanita's husband is drinking again and more than before. Based upon past experiences, his best bet is group treatment. But it needs to be in Spanish. Because of their situation, it will need to be free or sliding scale at best. They live in 78207. So I'm going to adjust the zip code to be the one, so it'll center the map then on those particular things. And let's see, this needs to be a group situation, so we'll call that peer support. And since we don't know the clinical term again, we're just going to use the experiencing definitions. And those make it easier to figure out the ones to select without knowing all of the details of exactly what the clinical situation is. So I've selected the feeling there, and now we're going to say we have to have this one in Spanish. And it's for an older person, we'll just call it an adult, and it needs to be free or sliding scale. So this gotten us down to 14 programs out of the many that we started this portal with. And 2 of them are online, so that might be helpful to the individual to get treatment. There's also, for example, if he's military or other forms here, there's some good options. And you can see the maps, dots are changing as I roll over the various programs so that you can see where they are in our wonderful community. I think this gives you an idea of how to use the mental health care portal. There are other portals on SACRD, And I have a Portals Basics the class if you would like to go view that video to get you familiar with how the portals work in general.